There have been a variety of estimates of the additional cost of health care to cover everybody in the nation. It's on the order of $100 billion a year. Until about 3 or 4 months ago, that number scared people. For reasons I think we all understand, it has less capacity to shock than it did back then. Indeed, the idea of spending additional money now in order to help spur economic growth is perhaps even a plus. So the cost obstacle is dramatically weakened. A second factor is that as people lose jobs, they lose access to health care, and they become fearful. Not just those who lose jobs, but those who fear they might lose jobs. So a dynamic that has occurred in the past may occur all too strongly now as unemployment rates rise. That is a popular concern about securing access to one of the most important services people have. Business leaders increasingly recognize that they cannot control by themselves the growth of healthcare spending. We have entering the White House a charismatic president supported by increased majorities, supportive in general terms of extending health coverage and reforming the system. So for all of those reasons, it's really not at all surprising that those who have been waiting a long time to see a bold thrust to reform the healthcare system are optimistic and want to go for broke. The obstacles, however, to action remain about as strong as they have been in the past when they succeeded in stymieing previous efforts. And for that reason, I think the central issue confronting the incoming administration is how to choose its strategy for making as much progress as possible. The reason this is so important is that there is one outcome that I don't believe either the nation or the administration, for political reasons, can countenance, and that is coming away, once again, empty-handed from efforts to reform the healthcare system. What are those obstacles? First of all, the U.S. healthcare system is dauntingly large. My colleague Charlie Schultz pointed out it's as big as the whole economy of France. It is not easy for a democracy, particularly a democracy whose political system is calculated to frustrate action when the population is closely divided. It is not easy for a democracy in one bill to change something the size of the economy of France. The industry is enormously diverse. It employs a great many people, probably more than 20 million in total, 700,000 physicians. There are 6,000 hospitals, each of which, incidentally, supplies jobs to communities and therefore is very difficult to downsize when that may be necessary to save money. There is an important basic fact about healthcare reform, and that is that first and foremost, since we're mostly going to be spending monies that we previously were spending, if it's reform, it's income redistribution. It's shifting spending, it's shifting power among groups that are going to be resistant, at least those who would stand to lose, resistant to action.